I'm Eddie Conway. Welcome to this episode of Rather Than the Bars. We have been following the state of prisons across the nation and the conditions of prisoners that's at risk as a result of COVID-19. It's important to point out here that the United States has the highest incarceration rate in the world, and many of the people locked up in the US would simply not be incarcerated if they were in other industrialized nations. So, here to look at the unfolding developments inside the US penal facilities during this public crisis is Kim Kelly. And to give us an update on what's going on around the country is Adryan Corcione. Thanks for joining me.
Of course. Thanks for having me.
Okay, I want to start off with an overview. So, Adryan, if we could start off with you and you could give us an update of what's happening around the nation. And then I will go to Kim Kelly and we'll talk about Rikers Island.
Thanks, Eddie. Yeah. So since launching COVID-19 behindbars.com, there's a lot of trends that we can see that are applicable to all different types of facilities, whether it be county or city jails, state or federal prisons, private or public prisons, detention centers, what have you. A lot of people behind bars are impacted in really similar ways, although there's definitely marginalizations that still exist. But like one big observation is that even the general public doesn't have access to testing. So there's a lot of people walking around who may be asymptomatic or people who do have symptoms but aren't getting access to tests. But for those behind bars, particularly prisoners, they have even less access to testing. So people behind bars might be being isolated and quarantined within their prison with flu-like symptoms or respiratory problems. But there's not really a system in place that we can ensure that the prisoners are getting access to testing so that we can have it confirmed. Lots of correctional officers do have access to testing that are being tested. But the truth remains is that prison healthcare is really poor. It always has been. And I think COVID-19 is exposing what was already there.
Okay, so let's for a minute look at Rikers Island. Kim, can you tell us, give us an overview? We'll go into some questions later on in detail, but can you tell us exactly what's happening right now?
Right. Well, I've been getting most of my updates from a dear friend of mine who has been incarcerated there for the past few months. I actually just spoke to him yesterday, and the situation right there is very dire. It's to the point where New York Governor Cuomo and Mayor De Blasio have been actually releasing hundreds of people, which is not enough to help stem the spread of this epidemic. It's a start, and there are a lot more people that need to be let out, but that's the point we're at. I think there are about, as of yesterday, so there's probably more now, as of yesterday, about 100 people, incarcerated people, were diagnosed with COVID, including, and there are also a number of correctional guards and all that. But my focus is on the people who are trapped there, who don't get to leave at the end of the day. And at this point, like for example, my friend, the person I talked to yesterday, he and his dorm have been in isolation, in quarantine for the past 8 days, 24-hour lockdown. They don't have enough masks. They don't have enough cleaning supplies. There isn't adequate testing going on, as Adryan said. People are still living on top of each other. It's a really dire situation, and it's only going to get worse as the virus continues to spread and as the facilities on Rikers Island continue to fill up with people.
And there was a report in Intercept about mass graves being dug by prisoners and they're being compensated. Do you know anything about that?
Right. Well, I actually reported on that a little while ago. But there is an existing program and has been at Rikers since the 1867, wherein people who are in prison there, they are used to dig graves on Hart Island, which is a potter's field on an island outside of, in the river. So this has been happening for a very long time. People who are incarcerated there are used to dig graves for the city's poor and indigent, unclaimed people who die. And now there is this report. I think it was compiled in 2008, in the wake of everything that was happening then, to sort of. I think it was like the Office of the City Medical Examiner. Their report or recommendations they put together for what would happen if a mass pandemic hit New York City. And there was a section about what would happen if there was an overflow of bodies, if the city morgue was just overflowing. And it was decided that people who were incarcerated on Rikers Island would be the people who would be tapped to dig those graves. And now we're at this point where it's happening, and where people, according to The Intercept, are being offered $6 an hour to dig these graves. And I spoke to my friend yesterday. He hadn't heard about it because his unit has been in lockdown. But like he said, a typical prison labor job at Rikers gets about $1 an hour. So people, if they're presented with this opportunity to make more money, will they take it? Will they not? He said he wouldn't. But this is kind of where we're at, where people who are essentially being used as slave laborers to dig mass graves for the dead in New York City.
Okay, but can you clear this up for me? Is that $6 an hour or $6 a day?
That way, I mean, this is the Intercept's reporting. I'm not sure what their sources are, but they're reporting that it was a $6 an hour job, which sounds pretty good until you think about the fact that bodies that are buried on Hart Island, they are not embalmed, and they're contained in pine wood boxes. So there is a risk of exposure there, on top of whatever mental strain that comes from knowing that you're burying the bodies of the dead while you yourself are trapped in a prison.
Okay, so let's look at Cook County Jail, and see what's happening there, and also look at the state of California and their prisoner release.
Yeah. So California has a system in place where the state prison administration is reporting positive cases. I'm not sure about Illinois, but as we can see in prospective states like Louisiana, up until today, they were not reporting the positives in the case. The state Department of Corrections was not specifying which facilities were had prisoners or correctional officers that had come test back positive, but I checked the site today and now they do. And we saw that in Georgia as well, where at first the Georgia Department of Corrections was not disclosing which facilities, out of like citing HIPAA violations. But once there was a prisoner death at Lee State Prison in Georgia, they are now publishing which facilities have tested positive. And then that goes back to, you mentioned in Cook County in Illinois, a trend that we see nationally is that people are dying. People are dying behind bars from COVID-19, and these are otherwise preventable deaths. And at Cook County, it was reported that there's a lot of cases that reflect to the degree of Rikers, where it's rapidly moving. There's dozens of people who are coming and testing back positive. And then in the news today at Stateville Correctional Center in Illinois, in the same state, there is a prisoner death. So we're starting to finally see in the past week that people behind bars are dying. These are otherwise preventable deaths, and the standards, health and safety standards behind bars of lack of access to testing, and on top of the horrific conditions of not having access to soap, not being able to use hand sanitizer, not having cleaning products to keep their space cleanly, really, really impacts public health for the worst. And this information is not being clearly communicated to the general public. A lot of this information I'm getting is from people who are in touch with people behind bars, or people behind bars directly. But yeah, the administrations are not communicating the conditions of what is happening behind bars. Certain states are adapting and letting the public know which facilities have tested positives amongst the prisoner population or amongst staff. But it's a really detrimental situation where we have, and it just further exposes the lack of transparency we have with prison administrations.
Okay, this is a follow-up. The federal government, the Attorney General Blair, um, issued a request that prisoners be released from the federal prison system, which is, I'm not sure the numbers, but close to 200,000 prisoners are held in federal jails and so on. But I understand that he made the stipulation that they use this algorithm called pattern, and it seems to be biased toward white collar criminals, which is primarily white people. I mean, have you looked at that, and what's your thoughts on that?
Yeah, I mean, I think calls for decarceration need to happen, but we are running into kind of this respectability politic within who gets to get released from prison. So lots of groups are calling for not nonviolent offenders to be released, but you know, this crisis does not impact just those who are labeled as nonviolent offenders. It doesn't just affect quote quote innocent people who are behind bars, right? It impacts everybody, and like it doesn't matter what your charge or conviction was. People are still going to be impacted by this. People are going to lose loved ones, and it just with in terms of an algorithm and what we know about racist policing in general. It's unsurprising and unfortunate that we have these distinctions that are coming out. But I think it's still really important to stress that abolition for all and that all prisoners are deserving of a quality life and quality health care and public health. These are calls for anyone who is a human. And I think it's important that people in the audience know that it doesn't matter what your charge is, you are still impacted by this. And anyone who has, you know, anyone who knows anybody in the carceral system will also be impacted, and that it's not a good precedent moving forward.
Kim, this whole thing with the release of prisoners in California, the federal government, uh, that's focusing mainly on white collar criminals, California that's focusing on criminals that has less than 60 days to do. Uh, what's the situation in Rikers Island? This seems to be a PR kind of uh, a sponsored reaction to the public outcry, but is this impacting prisoners that's really affected?
I mean, I've honestly been following this more closely from a personal perspective, keeping an eye on my friend. But I know there have been several hundred released. I think something came out yesterday that they're up to 1,900 that were eligible. It seems like it's moving very quickly, but also not quickly enough. Where politicians are saying one thing, but what's happening inside is very different. My friend was telling me a couple days ago about how this was a little earlier on before the big wave had happened and when there was a wave of several hundred people released in 1 week. So you're saying there are people that are being told you're going home and then they're kept there for 3 days in these crowded dorms with no information. It seems like it's very slapdash the way things are being enacted. And like Adrian was saying, it does seem like there's very much an emphasis on the nonviolent, like the good prisoners, which is a whole other conversation, right? But it's, as I was saying, this is something that this virus does not care what you may have did or may have not did. It does not care what a judge decided to put you away for. It affects everybody. And what's happening at Rikers, I just got an update as Adrian was speaking that there are now 212 confirmed cases of incarcerated people with this virus on Rikers Island, which is a huge jump from just a few days ago. Like this is spreading, and politicians, they De Blasio and Cuomo have this whole thing where they like to sort of, it's almost like playground antics. They like to jerk each other around. They like to to see who has more power, who's the big man. But these are people's lives that we're talking about. And it came out a couple days ago that I believe the commissioner of corrections, I'd have to find the exact title. There is somebody who has the power to unilaterally release as many people as are needed. Like all of these people have this power and they're dragging their feet. We saw in Jersey, where I'm from, as you can tell, a week or so ago, over 1,000 people were released from local jails, which is the kind of the kind of action that needs to be taken. In Rikers, it's spreading so fast, and people are so afraid, and it's already so like Rikers is a hellhole when things are good, right? Like at this point, keeping anybody there longer than they need to, which is not no one should be there for more than 0 seconds, it's just putting people at risk. And although the political maneuvering, these people need to get their heads out of, I mean, you know what I want to say. I don't want to curse on your stream. They need to get themselves together and take decisive action because we're running out of time.
Okay, Adrian, it seems to me, and as I was pointing out, this seems like a PR kind of stunt. The California thing is, even though it's releasing 3,500 people, it's people that would have been released in a month or two anyway. The thing that's happening in the federal government seems to be a white collar release. These things seems to be PR things. Are you getting the impression that they're just trying to save face and they're not really trying to save potentially at risk people in the prison systems?
Yeah, I can agree. It's damage control, because even the information that we are getting from California's Department of Correction is not cohesive. There's a lot of questions, even when we know um, that there are positive cases of COVID-19 behind bars in a facility. Um, Even if we know there are people, there's a lot of questions that loved ones are going to have. How does this impact my loved one behind bars? Are people placed in pods? Are people quarantined? What does it mean for a lot of people can't get in touch with people because it's on lockdown. There's no phone calls, there's no video calls. And there's definitely a lot of more press that I'm finding in the media analysis of people. Mainstream press is more likely to report on something on COVID-19 behind bars if a correctional officer has it, or if there's a celebrity, right? So there's a lot of stunts that are happening to get people on the side of they're doing everything they can. But if we're being honest with themselves, if the prisons were doing everything they could, they would not exist. And there's other trends that we can see too, like in Maryland, which now is reckoning with their first positive cases of those behind bars. The Maryland Department of Correction ordered all facilities to have free soap access to prisoners. But when I spoke to my friend who is incarcerated at North Branch Correctional Facility in Cumberland, Maryland, she has not had soap in months, which was the case before. So a lot of these stunts too, that not just of releasing people, but ensuring, people have access to clean facilities. It just becomes, are the prison administrations a reliable, credible source of information? And we see continually and time again, and a lot have what Kim has said too, from interviewing people who are impacted as prisoners, we can find that there is conflicting information.
This is a question for both, but Kim, you start off. You can answer it first. But let me back up a minute. Maryland, I have heard, has over 7 cases now, and some cases among the guard staff. It hasn't been verified. They're basically saying 2 prisoners, 1 guard, etc. But people from inside the prisons are reporting that there's far more, and that they're not really being kept at a social distance because they're eating in line and so on. But what should people outside do about this? Because I mean, as the days go on and the weeks go on, this could turn into a real serious epidemic in the prison system. It's already started, but I mean, this could lead to a lot of people losing their lives. Uh, what can people outside do? Kim, you want to start off, and then you can have the last word, Adrian.
Sure. What people need to be doing right now while they're at home, safe, is to be calling these politicians and expressing the need for them to release these people as soon as possible. Well, if you're in New York, you need to be hitting up uh, Mayor de Blasio, you need to be hitting up Cuomo. And there's another person, while we were talking, I got her information sent to me. Cynthia Brand, who is the commissioner of the NYC Department of Corrections, she has the power to let these people go. We need to be calling, we need to be emailing, tweeting, doing everything you can to express and show to these politicians who are in this position of power, who hold power over people's lives, that we're watching. We expect them to do what needs to be done. Public pressure is huge right now. In addition to writing letters, to sending soap, to sending, working with prison advocacy and prison abolition groups who are already in touch with people on the inside to find out what they need, how you can get it to them. Just really doing everything you can to help people who are prevented from helping themselves just by dint of the state deciding they don't deserve to.
Okay, Adrian, you want to follow up with that?
Yeah, what Kim said was great. I think now is a really opportune time to pressure public officials, because on the other side of this, whatever that will look like, the decarceration movement is not going anywhere. How can we apply pressure now and get the demands we want, is really, really critical. And two, writing to people behind bars, getting in touch with organizations like Swap Behind Bars and Black and Pink, Incarcerated Workers Organizing Committee. Those are some great organizations with local chapters that are doing the work to support people. And I think especially now that decarceration is becoming a reality in a lot of people's lives, even amongst the people who may have already were going to be released at some point soon, or just people who are completely unexpected getting home. I think it's really important that communities are showing up for people, for whether their families of loved ones behind bars, or there are people behind bars who no longer are in touch with family, who don't have that resource network. It's really important that communities who are also calling for decarceration are also calling for adequate reentry, because the connection between incarceration and homelessness is very clear. There's lots of formerly incarcerated people who don't have the same networks as they once did. In Pennsylvania, most prisoners come from Pittsburgh or Philadelphia, but the prisons aren't located in those areas. So when you get, when you're out of prison, it's like, okay, you're out, and then you're just on your own in a completely new place. I had a friend call me, a friend of a friend that I knew from behind bars, and she came home last week. And it's great that people are coming home, but also, what does reentry look like during COVID-19? This my friend wanted to apply for a job at Walmart, but she doesn't know how to use a computer. She can't go to a library to learn a computer class. I can't physically go with her to a library and teach her how to use it myself. So I think another step that we can all be proactive about is reentry, and how communities are handling homelessness and reentry during this time.
Okay, we're going to continue to follow this and keep an eye on what's going on around the country with your help, of course. So, Kim and Adrian, thanks for joining me.
Thanks so much for having me.
Thank you for having me, Eddie.
Okay, and thank you for joining this episode of Rattling the Bars for the Real News.
Thanks a lot for watching. Appreciate it. But do us one more solemn favor. Hit the subscribe button below. You know you want to. Stay up on the videos.